Tuesday, July 20th, 2021, 4 p.m. Please join me in a pledge of allegiance. Roll call, Doreen, please.
Amo.
Here.
Lujan. Sutherland. Tortel. Tui.
Here.
O'Donnell.
Here. Item number 1, Commissioner Miller, for your monthly update from the Department of Mental Health.
Good afternoon, everyone. Again, good to see you all. Do we have any changes? A couple additions, right? Okay, so let me just say, I'm sure you are all aware of our opioid crisis, our fatality as well as non-fatal overdoses, the increase in need for mental health services, both in adult and children. We are working diligently in the department to address that. One way we're doing that is continuing to expand our work with law enforcement. Tammy Ryan, who is our Director of Chemical Dependency Services, just completed a 40-hour crisis intervention training at the Police Academy in collaboration with the Police Chiefs Association. So we're very pleased to have additional officers there. We work together with New Windsor, who has applied and received some state funding to purchase an iPad, which will allow us to do some mental health police collaboration virtually. And they will have technical assistance from DCGS in doing that. So we're pleased to have that happening in the county. And we want to see if it's going to work for other police departments as well. We are on the cusp of scheduling an appointment with some of the well-known pediatricians who have committed themselves to understanding both mental health challenges as well as their role as pediatrician. And we really want to sit and brainstorm with them to see if we can partner more in depthly with them. For prescribers for children, we have 1 for every 29 that's needed. Nationally, those are the statistics, and we feel the pinch of it here in our county. We are using 311. Certainly people are calling the Department of Mental Health, and we're helping to plan. But we have parents who are trying to get appointments for their children who have an increased need at the end of this, as we're nearing the end of this pandemic, and they're not able to get appointments for their children. We're expanding using all of our social work vacancies, looking to fill them in our county clinics to be sure that we can take on additional caseloads there. Our issue is prescribers. It's very difficult to get a child prescriber, and we'll continue to pursue that. So just know that we're working hard. The 311 is aware and is working to help people put plans in place, but our community is struggling with this need. We submitted our annual local services plan. So we are required with the approval and support from our Community Services Board each year to submit a plan to the 3 state offices that the Department of Health is liaison with. And that plan has been submitted with our priority and goals, and it does include goals around the issues I just shared with you. We did submit, and this is in partnership with the Office for Aging as well as the Department of Social Services and community agencies, the partnership to support aging in place in communities severely impacted by COVID-19 application, and that will continue our Welcome Orange Geriatric Initiative throughout the county. Lacey Trimble, our Deputy Commissioner, led that project, and we hope to get funded for those requested dollars. We have had some community agencies come forward requesting to expand their services. We have one who's looking to be licensed as a outpatient mental health clinic. We have others advocating with the state, hoping they will get those licensed and be able to expand services in our county. We are this close to having MOU agreements between school districts, including Monroe-Woodbury School District, their attorneys and our attorneys. Believe it or not, it really has to do with cybersecurity is the last thing that's holding us up, and how we maintain secure networks while we're in somebody else's building. Then you have another school district like Valley Central that says, listen, give me the MOU, we'll sign it. That's how badly they want the services in there. So we're working on expanding. We have 3 right now that are in the works, and we'll continue to work with all of our districts that request. I ask you again to use your social media sites, use your connections, really market, market, market. There's services available. I had a meeting earlier this week with the New York State Office of Support Services, used to be Office of Alcoholism and Substance Abuse. Their statistic for 2020 show that 59% of beds across the state haven't been utilized last year. Now, we know the pandemic did keep some people out, but there are other reasons why they didn't come forward as well. So there is availability of service. We have access for service across the county. And if people need help, call 311. That's it. Questions?
Thank you, Commissioner Miller. I was wondering, two questions. Text for Teens, is there a success rate with that? Or do you guys see a lot of teens utilizing that program?
Yes, we do. I actually get weekly statistics from the Mental Health Association Crisis Call Center for teens that come in every week, and it's a significant number. Okay. So they do maintain regular contact from Text for Teens.
Great. Also, the amount of beds available for youth in hospitals. I know that NYU, toward the end of the school year, I was finding that it was very, very difficult to get a child mental health services along, help in that regard. What are you seeing now as far as the beds go?
Well, we're seeing that youth are showing up in emergency rooms. We had one that was in a local hospital for 36 days before the behavioral health unit. We're working closely with our hospitals in the county as well as with our regional Office of Mental Health. We agree with you that youth are not getting moved into the appropriate level of care in a timely fashion. Across the state, their utilization versus vacancy rates across the state. They see it really as a blip rather than a continuous need. So they have not, at least to date, approved opening additional children and youth beds across the region. Not to mention, there's not many facilities that are interested in going into that care because it's costly and it's not cost neutral. So it's a challenge. But we are working, in particularly with Garnet Health, to put a plan in place to try to prevent the use of emergency room for children and youth, and to have safety plans put in place to prevent the need for that level of care. So that's an ongoing work we have with them. They're saying their numbers are through the roof of children presenting at the emergency rooms, as many as 77 to 120 a month showing up with that need.
And I think it's unfortunate too, because by the time, let's say a family calls the house, quite often what happens by the time they get out there is the child is no longer presenting. Or by the time the child is seen in the emergency room, they're no longer presenting. And I think that's also something that needs to be looked at as well as, I understand that a child needs to behave a certain way and be saying and doing certain things, but, there are so many calls and there are so many, other calls that come in for mobile mental health to go out and whatnot, that by the time they get out there, even if a child's not presenting, it doesn't mean that the child isn't in need of that kind of help. So thank you so much. Thank you.
Yes, I would agree with you. I would just say that least restrictive environment, and there's specific criteria for involuntary hospitalization. So once they balance and they agree to a plan, hospitalization may not be needed that day, but doesn't change the next day. Make another call if the behavior changes. So I agree with you.
Thank you, Mr. Chairman, and thank you, Commissioner Miller. I want to kind of bring us to kind of the very beginning of your presentation, where you talked about the very clear rise in opioid-related incidents. What are some of the challenges that we're seeing? Are those challenges different from previous years? I know historically, and I say this also as someone who's worked in the field, housing is always a very big issue. Recidivism is always a big issue. Obviously, you have these beds, they're not getting there. some people don't know about resources, yet the resources are very clearly there. So what are some of the challenges that we're facing right now, and what can we be doing differently? And then as I touched upon the piece about housing, we have a moratorium that's going to be ending next month. I can speak very clearly from my community that, with a lot of changing demographics and things that are happening, housing prices and rents are significantly higher than ever before. We have a booming market where people are buying up homes. A lot of houses are turning into Airbnbs, means less housing stock. What are we doing and how are we helping to ensure that the residents of Orange County have affordable housing, particularly those who are maybe coming out of jail or prison and so on, and just anyone who really needs it, seniors, our youth and so on who are struggling at this moment. Thank you, ma'am.
Thank you. I'll take your first question first. I think that what we are seeing as through the pandemic, people are isolated. Relationship really helps recovery, and not having that face-to-face connection, having a great deal of alone time led to some relapse, which I think was very dangerous for many people. We also are seeing that with bail reform, we don't have the same mandated client base. Now that the courts are catching up, more people will go into court, and we may begin to see more mandated cases once again. But additionally, with people not going to jail, it's kind of the carrot and the stick when you're struggling with a challenge of addiction. The stick has gone away, so we need to build the carrot, and the carrot wasn't built as fast as the stick went away. So we're working really hard with putting together an overdose response team. We're working with law enforcement and with emergency rooms to have a plan to respond in a packet to give to the individual and or family of the person who survived an overdose. We're doing that in partnership with the Department of Health as well. And we also need to use 311. We need to encourage people to reach out for help. So those are some of the things that are changing. The other thing I want to say, fentanyl has been consistent throughout. Fentanyl is most often the substance that leads to fatal overdose. And we are moving into an increase in cocaine use, which was anticipated. Cocaine can be laced with fentanyl. As we go to legalization of marijuana, we'll have additional challenges there. We hope it's pure marijuana that people are using and not laced with anything else. So we have a lot of challenges when we look at how we're responding to this need, but we have a system of providers who are looking to address it. As far as the homeless, we did discuss this in the last committee meeting, so I'll just be very brief in saying that currently our numbers are down. We have capacity in all of our temporary housing provider systems. We only have 4 singles and hotel motels right now. As the moratorium lifts, we expect that we're going to have permanent housing. As you just spoke about the competitiveness in the market, it's gone. So we are aware of the challenge. There are some for development, some home applications that they've received. We're hopeful those projects will get approved, zoned to all communities, I think, right now. Thank you. Have a good afternoon.
Item number 2, Commissioner of Health and Deputy. Welcome. Item 2A is a local law to amend the Orange County Sanitary Code pursuant to legislative request number 124. Do I have a motion? So moved. Second. Thank you. Turn the mic on, please. Red light will come on.
Just adjust it. Good afternoon, everyone. Thank you, Mr. Chairman. As you have mentioned, this is an item to amend our sanitary code. Basically, it's a section, we have discussed this with our, it's to amend our sanitary code specifically to remove the item that specifies minutes of formal hearing for examination to all parties. It's essentially the transcription of that hearing, that he will still be made available, will still be recorded, but the transcription we have ran against issues in just obtaining a transcriber for all meetings, and that has really paused a lot where we are with this item. Thank you.
Any questions?
Thank you, Mr. Chairman. So you're proposing to, as opposed to having a video transcription or video available?
It's an audio recording that may be made available for transcription if requested, but not transcribed at the time of.
Okay.
That was really the issue.
Taking effect language barriers and ADA. Thank you, Mr.
Well, I think in every previous hearing of this type, there was always a court reporter, unless they specifically request one at their own expense. However, if there's an issue after the hearing, transcribed, of course, they'll be able to get it. But this just eliminates the expense of having a court reporter at every hearing. And my guess is, if we look back, there's probably hardly ever been a transcript requested. Cost saving with. All in favor? Opposed? Request to accept and appropriate funds from the New York State Department of Health for the Public Health Emergency Preparedness Grant for the period 9/1/2 to be used for the opioid crisis. $72,000. Legislator Sutherland and Legislator Tortel. Thank you. Go ahead, Commissioner.
Thank you. Effective September 1st, we, as per the State Health Department, began the overdose data action contract year. The contract was in the amount of $72,000, and there is an approved plan that is made available. It is essentially fringe benefits, base salary, subcontractor, office supplies, so on and so forth.
Any questions? Seeing none, all in favor? Opposed? Carried. Item 2C, request to accept and appropriate funds from the New York State Department for the Childhood-Led Primary Prevention Program grant for the period 4/1/2020 through 9/30/2020, out to $584,873. Legislative request, we have a motion and a second. Legislator Lujan and Legislator Tortel. Thank you. Go ahead, Commissioner.
Thank you, Mr. Chairman. I'll have my Deputy Health Commissioner discuss the lead grant briefly.
Okay, sure. This is fine. Great. So this is, as you'll notice, first of all, in this, the period on this is 4/1/2020 to 9/30/2020. The New York State grants are being held up for a while, so basically this is just getting through. So that's a long period, matter information, just getting the basics there, and also kicks our environmental health division into action as far as doing the actual investigation, trying to figure out where a child is getting lead poison from. So our investigation usually takes us right to their original dwelling, their immediate housing, and to any place where that child may visit for at least 8 hours per week, where we'll go out there. And that investigation includes us testing parts of the house. We use a machine called an XRF, an X-ray fluorescence machine, where we put a machine basically against a wall and test it to see right there without disturbing the paint to see exactly how much lead is in that surface. And there's a certain level and action limit there that tells us, you know, it's positive for lead. The challenge there is, of course, that just about all of our building stock in the state, you know, is older building stock. And most of it has lead in it, quite honestly. And when we live in Orange County, we look at some of our municipalities, you know, obviously Newburgh, Middletown, and Port Jervis, some of our older cities, there's quite a bit of lead building stock in there. So to think that you're going to get the lead out of those buildings is, you know, it's not something that really can be done efficiently, effectively, and safely, quite honestly. So it was determined really a long time ago that we're looking to keep things lead safe, so that there may be lead there, but if it's in a condition that's not conducive to lead poisoning, if it's not chipping, flaking, or creating any dust, then we really don't need to do anything with it more than that, right? Because the layers of paint that are above that lead are non-toxic. Our current paint levels don't have any lead in them. So our concern is to make sure that things are lead safe and that the environment is safe for that child. And also, so if we do find lead in a place and we find it conducive to lead poisoning, so it's cracking, chipping, or dust, we send out a notice and demand letter to the landlord, the building property owner, where they have to submit a plan to us to show us how they're going to correct it, how they're going to make it better. Many times it's just cleaning it and repainting it and making sure that if there's any friction surfaces that they're not grabbing or pulling or making a condition that may be conducive to lead poisoning. Many times window jams are a big area where they go up and down and that creates dust, or a door jam that also may be a problem. So a notice and demand is sent out, a work plan is sent back, we review that, we accept it, and the work is done. They get a certain amount of time to get that work completed. We go out, we do a re-inspection. We do a re-inspection with dust wipe samples also to make sure that the work was done in an appropriate manner. And there is a certification class to actually do that in an appropriate manner, and we provide those classes also free of charge to landlords so that they can learn how to do remediation and make things lead safe in an appropriate manner. And so we do dust wipes to make sure everything's clear before we give the okay on it. When blood lead levels get to a certain, like over 14 or higher, or we've had some cases, 30 or 40 with a child's blood lead level, that's a very serious level. And in those cases, we don't want the child in that environment. We usually have the child put into a different environment. We see if they can go to a relative's house. We check that environment before they go into it. But many times when a child's blood level is that high, they're usually hospitalized also, and they start going through a chelation process, which is also, kind of dangerous in itself because you're introducing almost like a poison into a child to get rid of the poison. And they're very vulnerable at that point. So we want to make sure that they're in a safe environment, that chelation process is going okay. So in those instances, when we know a child has a very high lead level, we go out immediately. We make sure that the environment is safe, or if we get the child into a safe area, and the remediation, the child cannot go back into that place until the remediation is actually complete, until it's made safe. So that, that used to happen a lot more often when I first started in the program. It happens, thankfully, a lot less often these days. Again, we don't have as many cases mainly because of our education that's going on out there. Our education with landlords and education with tenants, all those types of things. So it's public health that's really worked very, very well. And it's a situation that, the lead really hasn't gone anywhere. The lead is still there, but we've educated the people on how to live in it safely in that environment.
Thank you. Any questions?
Thank you, Chairman. Thank you for that extensive review. One question in terms of enforcement. Do you find good compliance on the part of the owner of the property in terms of doing the remediation that you call for?
Typically, we do find good compliance on it because one of the things is, early on in this, we would find landlords that would actually try and get rid of the tenant in order to try and get rid of the problem, and that doesn't get rid of the problem. You know, we copy all the building inspectors on these things also, so they can lose their certificate of occupancy on that, and they won't be able to rent it out to anybody until they get it completed. So that in itself, you know, is a great way to keep compliance with them.
And about how long does it take from the point that you determine that there is a lead issue that needs to be remediated and the actual work getting done?
Right. I mean, it depends. There's some that go on for an extended period of time for sure. And there's some that get, you know, done quickly. We like to try and get things done within 60 days.
Good. Thank you very much. Thank you, Mr. Chairman.
Anyone else? Seeing none? All in favor? Opposed? Carried. 2D, request to accept and appropriate funds from the Department of Health and Human Services for the Orange County COVID Response to Advanced Health Equity Grant for the period 7/1/2021 through 6/30/2023 in the amount of $800,000. Legislative request number 132. Okay. A lot of action on the left side here. Legislator Lujan, Legislator Tortel. Thank you. Go ahead, Commissioner.
Thank you very much, Mr. Chairman. The Orange County Department of Health was very fortunate to receive one of the 73 grants awarded from the U.S. Health and Human Services Office of Minority Health as part of a new 2-year initiative to identify and implement best practices for improving health literacy, to enhance COVID-19 vaccination and other mitigation practices among underserved populations. As you have mentioned, the award is for $800,000, and over the next 2 years, the Orange County Department of Health will partner with SUNY Orange and Cornerstone Family Health to develop health literacy plans to increase the availability, acceptability, and use of COVID-19 public health information and services by racial and ethnic minority populations in the cities of Newburgh and Middletown, as well as their surrounding areas.
Any questions? Legislator Lujan.
Thank you, Commissioner. I just wanted to ask, I mean, I know we've talked about this at length throughout the year, and these funds are obviously going to be very, very useful. Do we have a projection of some of the things that we're going to be doing to kind of improve the equity? Has anything changed from the original plans that we feel might be, might work better, considering what we're seeing probably in other parts of the country? If you could maybe talk about those.
Absolutely. It's actually perfect timing for that question. Thank you very much. We are one of the few counties that actually have a health equity director right here at the health department, so we're quite fortunate to have that at baseline. But also what has changed and where we are brainstorming right now is, and that will bring us kind of smoothly eventually into the summary that I will provide, but we have the CDC here with us this week. And we are actually, in conjunction with our own staff and the New York State Department of Health staff, are conducting a rapid community health assessment, specifically addressing vaccine hesitancy all across the county, but we're really focusing in on certain areas of the county with reported high incidence of occurrence of disease early on and throughout the pandemic, as well as low vaccination rates. So as we are assessing the contributing variables to actual vaccine hesitancy, because clearly throughout the county, even though there is some vaccine hesitancy, the reasons for the vaccine hesitancy are quite different, and they vary throughout the county. So that's exactly what the CDC, along with our Community Health Outreach Division, Epidemiology, Nursing, and the New York State Department of Health is currently attempting to assess. So hopefully by this Friday, we will come up with an evidence-based mitigation strategy just to address various reasons for vaccine hesitancy.
Thank you, Mr. Chairman. As a follow-up, have we seen that the language barrier that we experienced in the past, has that still remained to be an issue? That I know in the city of Newburgh, I speak to a lot of community members from the Haitian community, the Spanish-speaking community, and the hesitancy is still quite present, and the misinformation is still very present. So deep into this pandemic, which is obviously very worrisome, considering that it's such a large segment of our population. And obviously, I want to make sure that my community members throughout my district and throughout the city and neighboring communities are going to be safe. So just wanted to know if that was something that was seen and noticed, and if there were being steps to further address that.
Absolutely. Thank you for that. It's definitely multifactorial. The actual underlying etiology for vaccine hesitancy is quite different. We just met, for instance, with We were in Monroe yesterday with the CDC, and some of the underlying etiology for vaccine hesitancy, there are some similarities across the board. So for instance, some of the misinformation, as you've mentioned, it does penetrate throughout different subsets of our community. Language barrier is just one. There are definitely other barriers, as well as the hesitancy itself is rooted in completely different causes. And that's what we're trying to assess. Just to give kind of an overview of where we will be all across the county. And the breakdown by zip code as far as vaccination percentages, for instance, Monroe, the zip code 10950, has the lowest vaccination percentage at 27.1% for people with completed vaccine series. And we have our zip code in Tuxedo Park, which is 10987, at the highest vaccination percentage at 91.5% for the same category of people with completed vaccine series. So clearly, there's a tremendous barrier in some areas, and some areas we're seeing a very high vaccination rate for one reason or another. And that's something that the CDC will attempt to establish as far as what are the actual underlying root causes. Other areas that we are visiting, again, based on vaccination percentages, Middletown, Newburgh, we are visiting Port Jervis, Sparrow Bush, kind of that western region, because there we're seeing vaccination rates for Cutterbacksville, for instance, 12729 is at 29.9% vaccination for people with completed vaccine series. We have Huguenot at 39.9, Sparrow Bush, Port Jervis, 12771 zip code at 37.4%. So there's clearly a very broad spectrum of vaccination all across the county. So hopefully the CDC would shed some light as to best practices to mitigate that.
Legislator Tortel?
Thank you, Mr. Chairman. Thank you, Commissioner. Can you give me, I haven't had a chance to look it up, do you know what our current vaccination rate is for people who are fully vaccinated in Orange County?
I would have to report it. I have not seen it as of yet, but we're fairly in line with the actual state vaccination percentage. So we're somewhere at about 55% if we were to calculate actual federal data, because I think I reported early on, even though our vaccination percentage for completed vaccine series and total population was reported to be lower than the Mid-Hudson average and lower than the actual state average. Once we took into consideration, and unfortunately the New York State vaccination workbook does not report federal data. And for us, that's very substantial, because with having large military installations or any large populations such as veterans or other populations that would be vaccinated through the federal vaccine program, that wasn't originally calculated in those percentages. So if we were to calculate that, we would be at approximately 52 to 55% of total population vaccinated, and this is completed vaccine series.
Right.
I know we have all heard the alluded to 70% vaccination rate statewide. That's of adults 18 and over with one vaccine dose. Right. So if we're discussing total vaccination throughout total population, because clearly disease propagates throughout the total population, right, regardless of age or any other factors. So from a communicable disease perspective, we report vaccination similarly in a total population. So for total population statewide, the state is also at about that 55% total vaccination for completed dose series.
Do you know what our current COVID positivity rate is and hospitalization?
Yes, I will send that over. I don't have the update. As of 7/14, I have the latest update, because that's the summary report. As of that date, we have reported 47,874 cases to date. And that was an increase at that point of cases. As of today, we have 48,004 cases. We are seeing a very slow but very steady uptick in new cases, unfortunately.
Have we tested positive in the county for the Delta variant?
No, we do not have lab-confirmed Delta variant that was reported to us by New York State Department of Health as of yet. That's not to say that it may not circulate, because clearly it would have to be sequenced and it would have to be verified by the lab. We do not have a lab-confirmed case of the Delta variant in the county, as was reported by the state. as of yet. Our rolling 10-day average, as of, again, 7/14, was 11.6 cases per day. And at that point, which was almost a week ago, that was a decrease of 4.1%. Unfortunately, as of today, as I stand here, we are experiencing a slight increase overall day to day. The median age is younger. We are seeing a younger cohort. And we had 4 deaths reported in June and 1 reported in July. And the age median and average was slightly younger, but still in the 70s.
Thank you very
That's
much.
right, absolutely.
Thank you, Mr. Chairman.
Legislator Amo.
Commissioner, when you sort of clarified, but I want to dig a little deeper into it. You talked about how the state defines the percentage, the 70% of people above 18.
Correct.
When we look at our numbers, are we carving out below 18? Or are we taking, is the numbers you just reported, are they just 18 and above, or is it the whole population?
That's a tremendous question. So the state reports both. The state is reporting, actually at this point, they're reporting really 3 numbers because of the availability of 12 to 18 vaccines. So they're reporting 3 numbers, 12 and up, 18 and up. They're reporting 18 and up with 1 dose. They're reporting all 3 categories with 1 dose, at least 1 dose. And they're reporting all 3 categories with complete vaccine series, whether 1 Johnson & Johnson 2 weeks out, and 2 doses for the mRNA vaccine, Pfizer and Moderna 2 weeks out. So we do have that. Similar to the state, Orange County has about a quarter population that is under the age of 18. So we do have that 25%. From a communicable disease perspective, as far as public health interest, because disease propagates in all age categories, and I think I've reported this before, for our demographics, our total number of cases as of July 14th was 47,889. Of those, 5,920 were 17 and under. So children are quite well equipped to contract and transmit COVID-19. What we're seeing being reported preliminarily as far as Delta variant, it is spreading a lot more rapidly among unvaccinated populations, regardless of previous COVID status, and it is more transmissible with children. I think the latest data, and again, it's very raw data, I don't know how valid it is moving forward, but Delta variant has been reported to be 200% more transmissible, so more kids and more unvaccinated individuals will be transmitting and contracting. And Delta also has a much higher viral load, which is good news for testing because they will test earlier and it'll be a more conclusive result early on. But Delta has a 1,000% higher viral load than previous variants that we are seeing. Clearly, there's the virulence factor, not just transmissibility, but also the viral burden itself.
The other part that goes with that, the numbers you presented to us when the CDC is going around the county, were they percentages based on total population or just above 18?
So the CDC is going around with our staff just to conduct rapid assessments, and that's just...
You were reading, like you were saying, Cutterbackville.
So this is New York State Department of Health zip code data. So the zip code data is people with completed vaccine series. So they take a total population because in order for us to assess potential for propagation, we need to take a total population. So these specific numbers are by zip code and total population. They do report out people with at least 1 vaccine dose, but again, it's not broken down into 18 and under or 12 and under.
I think it's fair for the record, like for the town of Monroe and that zip code, which represents my district of Palm Tree, 50% of the people are our children are under the age of 16. Probably even under the age of 12, there's probably 30-40%. So that really brings the number for Monroe down, or that zip code down, because there are so many people that can't get it, period, because...
Absolutely, because they're 12 and under, absolutely. That is absolutely a factor. Unfortunately, as we're seeing a variant of higher virulence and transmissibility, for our purposes...
It's not an excuse not to get up to 80, but I just want to, when you tell people the numbers, you got to say, well, it's for a certain age group that we got to come out of that so we can compare them. Because some communities, maybe even my town of Woodbury, in our zip code, we may have a very small percentage of children in the area. It's more of a bedroom community, a working community.
And it's absolutely a consideration. But when
Yeah, our
we're,
numbers may look really high, but, you know, compared to somebody who has a lot of children, it's different.
absolutely. And as we're looking to the fall, unfortunately, that in and of itself, having a higher percentage of children 12 and under, as far as transmissibility and potential of outbreak, it's also right up there.
No doubt. No doubt. Thank you, Mr. Chairman.
Thank you, Chairman. Commissioner, with the, every test that's being done now in Orange County, and the state has the results and all, are they testing, are there are they testing for the Delta variant?
That's a fantastic question. So the PCR test at baseline, the test for COVID-19, the confirmatory test for COVID-19 does not. They actually have to do the typing for it, and they have to see what type it is. With that said, quite a lot of the specimens, a lot. I don't know the actual number. I can try to get that number. I really don't know at this point what percentage of the total PCR tests that are conducted are sent out for subtyping. But that's almost a separate test in and of itself.
So if you, if someone tests and then it comes back positive, would that automatically go, and it goes by the criteria of the baseline test, and then they would have to
Sequence it.
Does it depend on symptoms?
have to do the
types
typing
of
for them.
symptoms, or what facilitates?
So once it's
Test.
positive, because of the prevalence of Delta variant anywhere where they are seeing a lot, so let's say New York City has reported over 178 cases, I think at this point, of the Delta variant that have been confirmed. Now that there's a higher prevalence of the Delta variant, more facilities will be sending out positive results to get sequenced, but that's not all facilities. So it's very facility dependent. As you have more of that particular variant circulating, it's more likely that they will order the supplemental variant.
Has the
testing.
state ordered any of our tests?
Yes.
To be tested by Delta? And what
Yes.
number is that?
So
Low number, or is it?
we have had no confirmed Delta variant in the county at this point.
And how many tests would that be? How much
Thousands.
percent of tests? So thousands
Thousands of
tests in our county
specimens
have been
have
sent,
already been sent in. Yes.
and we haven't had any.
We have not had any at this point.
Yeah.
Not to say that it couldn't be circulating, but we just don't have a lab confirmed value.
Okay, thank you.
Absolutely.
All right, Legislator Luan.
Thank you, Mr. Chairman. Just a very quick question in regards to, you did say that the percentage of those who were not vaccinated was very, very high. I think I saw it in like the 99% or 90-something percent. But have we seen any indications of people who have gotten sick despite having both doses? Are those numbers high? I think there's a lot of people who are still, because they're concerned about the vaccination. I want to kind of indicate to them that, look, this is what we're seeing. It's significantly much better, obviously, to have the vaccine than not. But can you tell us if there are instances like that? Thank you.
So as far as vaccine breakthrough, I think you're alluding to vaccine breakthrough rates. Vaccine breakthrough rates, both statewide and locally, have been very low as compared to unvaccinated reinfection rates, because that's what we tend to kind of compare it to. We have had hundreds of cases, and I can get exact figures for locally. I don't have them in front of me. We have had hundreds of cases of individuals being secondarily and tertiarily infected. So we have had individuals that were infected early on throughout the progression of the pandemic. They have been infected midway, and they have been infected for a third time. So we have had some of those individuals. We have had individuals that were secondarily infected, and that number is in the hundreds. And these are unvaccinated individuals. Similarly, we have had, I would say up to this point, last time we checked, was it 25 confirmed? I have to,
Yeah.
It's been a little while, but just as a comparison, we have had hundreds of secondarily, tertiarily infected. We have had about 25 last time we looked at it. I can analyze the data, give you the exact kind of comparison, but the number is a lot lower. What's a very significant factor when discussing that is not just the vaccine breakthrough potential, which again has been significantly lower even than vaccine trials. So if it's statewide, about 1%, that has been the reported vaccine breakthrough rate statewide. In clinical trials, that was a bit higher. It was anywhere 4 to 5, 6%, depending on vaccine. None of those individuals have been hospitalized or have presented with complications. So they had a very mild sequelae and progression of disease or were asymptomatic to begin with. And even if they were symptomatic, they were not hospitalized. So nationwide, those trends, so today, out of every single individual that is hospitalized today with COVID-19 in the nation, 99.2% are unvaccinated and 0.8% were vaccinated, which again is a testament to, yes, vaccine breakthrough at 0.8% for hospitalization versus 99.2% unvaccinated that have been hospitalized with COVID-19. And I think just to put things in perspective, that's a very tremendous issue to bring up is potential or risks involved with vaccination themselves versus risk involved with COVID-19, not just the disease progression, but also complications that we are seeing after the fact and long term. Absolutely. So, I'm sorry. So again, with the Delta variant for both mRNA vaccine and the Johnson & Johnson vaccine has been tested. With the Delta variant, both mRNA vaccines and the Johnson & Johnson vaccine have been proven to be very effective. Not as effective with the variants as it has been with the variants that we have seen previously. What I mean by that is in clinical trials with regular variants that we have seen up until this point, and I think we can all remember the UK variant, Brazilian variant, so on and so forth. The clinical trials have shown that the vaccine was highly effective in the current dosage and administration intervals. So with both doses of mRNA vaccine, it was about a 96% efficacy or somewhere in that 90% range, high 90% range, depending on vaccine type. With the Delta variant, it was still proven to be successful, but to the tune of about 88% that has been reported. It's still fairly effective. We're seeing a little more breakthrough. However, we're still not seeing hospitalizations and deaths, which is really, that's the driving factor there. Absolutely.
Any other questions? None, all in favor? Aye. Opposed? Carried. 2E, request to accept and appropriate additional funds from the New York State Department of Health for the Epidemiology and Laboratory Capacity ELC COVID-19 grant for the period 7/1/2020 through 3/31/2023 to be used for enhanced detection, surveillance, and prevention of COVID-19 in the amount of $1,050,508. Legislative request number 134. Motion by Legislator Tui, seconded by Legislator Tortel. Go ahead.
Thank you very much, Mr. Chairman. The Health Research Inc. And the New York State Department of Health were awarding additional funding, and that additional funding across the state totaled $32,850,000 to local health departments for enhanced detection and expansion of COVID-19 surveillance and prevention. This award was funded 100% by the CDC sponsored cooperative agreement, and that was for epidemiology and laboratory capacity for infectious diseases. That's really the explanation for the funding itself. And as that funding was made available, Orange County's portion of that was $1,050,508. And this surveillance funding will be instrumental as we are heading into the fall, especially with the circulating Delta variant. And surveillance testing really, it's not diagnostic testing, it's not individualized testing, but surveillance testing would include everything under this specific grant funding. Would include anything from wastewater testing, which is really the primary means of early detection and surveillance, to, let's say, pool testing that we have seen take place in SUNY colleges across the state. And what I mean by early detection system, clearly if you're seeing an uptick of viral burden in wastewater, that's a great indicator for that particular area to start other means of surveillance testing, such as saliva pool testing, which are not as invasive and not as costly. And if we detect an increase in positive values there, then we can move on to diagnostic and PCR testing recommendations that are more diagnostic and individualized. That's really the breakdown.
Any questions? So with regards to the pool testing, that's just public pools that you look at?
So
Private pool companies such as Royal and Chafee, there's a number of them that pool owners get their water tested. So are they testing?
No, so I apologize for that. By pool testing, what I mean is saliva testing, so it wouldn't be individualized tests with swabbing, which are diagnostic. It would be quite literally a pool of candidates, let's say 20, 30 individuals, saliva testing for those, combined for those 20, 30 individuals, and those would be sent out. As far as wastewater testing, Newburgh was actually a pilot model for wastewater testing early on in the pandemic. It was one of 6 municipalities that was selected randomly with Syracuse, I believe Albany, others, where when we were seeing a decrease in total new number of cases, wastewater was tested and seeing if we had increases of viral burden in wastewater. And that was really great to establish baseline. And now moving forward, we really have a tremendous tool with wastewater testing surveillance, because if we're detecting an increase in viral burden in wastewater testing, it's a great indicator early on, prior to even the individual being symptomatic or even knowing that they're positive, because clearly the wastewater shows that increase. Obviously, it's not diagnostic in nature because we don't know which individual's excrement this really is. It's a pooled test, but it's a great indicator if, especially for our densely populated areas, if there is an overall increase that's sustained over time, and if there is, that we can then implement other means of surveillance, such as saliva testing, so on and so forth, and then diagnostic testing as a result.
Commissioner, when you say it's wastewater testing, and you're saying it's individual, so are they?
It's not
I mean,
individual.
are you going to treatment plants?
Yes, so it's just municipalities that test their wastewater for other things potentially. This is just one test that's available to see the amount of the virus in excrement, to see if there is an increase over time for that particular area and municipality.
Yeah, because in 10950, in the zip code, we have the sewer district, which encompasses pretty much that area with Palm Tree, Monroe, Woodbury, parts of Blooming Grove, and Chester. So if you got that, how would you know where to track back to?
So it's a phenomenal tool, and from what we have seen in the pilot tests with Newburgh, we have seen an increase of viral burden in wastewater about a week to a week and a half prior to receiving lab results, actual lab confirmations, and kind of throughout that area. So when I say it's an early detect system, it's great to really have that aerial overview of which municipalities, for the municipalities that would be testing, God bless you, for the municipalities that would be testing, if they are seeing a sustained increase over time. And if they are, we can go to congregate areas, workplaces, we can go to schools, and then potentially monitor via saliva pool testing if there are certain areas of high congregation or many residents, congregate housing, so on and so forth, where we are then detecting infection in those saliva pools tested. And if those test positive, we can then have the
So if you
PCR
had
swab
8 or
test.
9 communities that were going into one plant, you would
We would discuss it with,
test the 8 communities.
yes, with the high congregate, densely populated areas, we would have that saliva test available. That's a lot more
I guess the question
fiscally
is,
responsible.
know which community would go.
For the community that's tested. So if it's multiple communities that are in that kind of wastewater
Like you
pool,
said, it could be 8, 9.
If I could just add to that, the Newburgh plant, when they were doing that study there, so the Newburgh plant takes Cornwall, New Windsor, and the city of Newburgh. And in that particular plant, it's designed so that they have an inflow, they know the inflow from each municipality coming in there. So some of that is based on how the plant is designed, for sure, and them being able to figure out which line is coming from which municipality. So when they were testing down in Newburgh, they were doing it not only just in the plant itself, but they were actually doing locations coming in from
By
each
community,
pipe,
by the-
from each municipality. So if that treatment plant is designed that way, they can narrow it down.
but if not, there will be a public health announcement to that entire area.
Okay.
Thank you, Chairman. Just a question relative to this testing. How does the testing deal with asymptomatic individuals? In other words, you could see a large spike in the virus in the wastewater, then you may not see a similar response in the general population because of asymptomatic individuals. Is there enough data to really be able to make good judgments?
Absolutely, and this has been a phenomenal tool for that early detect, and that's a tremendous question. Once we see that increase, it's a fairly conclusive increase because it does detect actual viral burden of SARS-CoV-2 present in that wastewater. And if it's a sustained increase over time where this is not just a random kind of sampling, this is a sustained increase over time, we know that that particular area now has either a cluster or a potential for outbreak later on of the disease. So we would go to areas of either high congregate housing or areas that employ a number of individuals, or schools or other facilities that have a tremendous amount of individuals there at any given time. And then we would test to account specifically for what you're saying, the asymptomatic individuals, or maybe even mildly symptomatic individuals that are just simply unaware that they happen to be carriers. And the secondary surveillance testing portion, not the diagnostic aspect where it's one-on-one, but the surveillance portion actually includes, and SUNY Orange does have some data available from their saliva pool testing that they have conducted, where they would have these smaller cohorts of 10 to 20 individuals. They would actually go in, they would submit their sputum, that would be combined into one pool, so pool from 20 individuals of that sputum, that would be submitted, and if there were any viral particles detected in that pool of saliva, then that every individual, let's say 20 or 10 or 15 that participated, they would then be individually tested. This avoids a large expenditure of having to really swab and track all of those individuals and have that diagnostic component where every individual has to be notified of their negative or positive test. Here, you're just testing that pool sampling. It can be done at regular intervals if we're seeing it in the area that has seen that sustained spike of wastewater viral burden.
Okay. And then how long does it take from the time the sample's taken from the wastewater to getting a result?
It's continuous. So they would continuously test at regular increments. I think they've conducted it weekly in Newburgh.
Yeah, because we don't do the lab testing here.
It would be the state.
It's sent out, so it's the Wadsworth Laboratory. So I think it was done every couple days. They're collecting a sample, and they get the results on it within 24 hours, I believe.
24 hours.
Yeah.
So it would be possible then to look at your waste shed if you see at the plant, as Legislator Tui was inferring, you could see what was happening at the plant and then be able to go and break it down by samples further up in the system.
If your plant is built that way, yes.
Yeah, I mean, there was even some studies that was done on this with college dorms and actually isolating wastewater from college dorms and seeing, actually collecting it as it's going out the pipe and just seeing, how many 800 kids in that dorm, if that dorm has got a positive case in there or not.
Thank you.
Anyone else? All in favor?
Aye.
Opposed? Carried. 2F, the monthly update, please.
Thank you very much, Mr. Chairman. As I have mentioned regarding the Health Department receiving the grant award from the U.S. Health and Human Services Office of Minority Health, we are very much looking forward to working with SUNY Orange and Cornerstone Family Health to develop our health literacy plans to increase the availability and acceptability in the use of COVID-19 information and services throughout our cities of Newburgh and Middletown and the surrounding areas. The CDC is currently with us, so they have sent doctors and epidemiologists, as well as the New York State Department of Health, to work with our doctors and epidemiologists and nurses in our Community Health Outreach Division. They will be here from July 19th to July 23rd to help us conduct a rapid community assessment around vaccine confidence in the county. This was offered by the CDC as a resource available to all municipalities and all localities across the state. They have already conducted a number of rapid community assessments throughout the nation. The two CDC experts have already visited a number of locations along with our staff. They always travel with the Orange County Department of Health staff, and they essentially conduct listening sessions and casual conversations with community leaders and just the general public. There are some focus areas, as I have mentioned previously, Newburgh, some of the areas encompassed in the zip code 10950, the western part of the county, including Port Jervis, Cutterbackville, Westtown, Huguenot, and Sparrowbush. The areas of focus, as I noted, were chosen based on vaccination rates that have been provided by the New York State Department of Health, and those were broken down by the zip code. And the goal of the visit is really threefold. It's to carry out the rapid community assessment with the communities identified at risk for low uptake of COVID-19 vaccine, maximizing established relationship with our local community organizations. And there are a vast number of community organizations participating in this assessment. For instance, faith-based, non-for-profits, businesses, and of course our local public health department. The second goal is really to identify appropriate solutions to increase vaccine confidence in selected communities. And the final portion is really to build Orange County Department of Health and partner capacity for similar assessments in other Orange County communities. A focus that will, moving forward, still include the areas of high prevalence of disease and low vaccination percentages. As far as the general COVID update, we continue to hold vaccination clinics. They're held twice a month in Middletown and in Newburgh. They're by appointment only. The phone number is 845-291-2330. That's to make an appointment for our clinics at the health department. We still continue to recommend that individuals go to www.vaccines.gov. That is the streamlined means of just entering your zip code and looking up the closest vaccination location with available vaccine type closest to your place of residence. As far as homebound populations, I'm actually glad to report I came back from vaccinating our 90-year-old resident in Washingtonville. So I was just there minutes prior to the meeting, and I'm very happy to report she's doing very well. But we continue, our nursing division continues to vaccinate the homebound populations. And anyone who's interested in receiving the homebound population can register on our website at www.orangecounty.gov and just click on the homebound tab. Or if they cannot access a computer or cannot register, they can absolutely call our office for the aging to assist them with that. And finally, I would like to mention that an area of some concern at this point, this has been reported nationwide, but there has been a substantial decrease in age-appropriate vaccination across the board, not just COVID-19, and especially as it pertains to school-age children. We saw this last year in Orange County, and we absolutely expect to see this again this year with children going back to school. It will be important to note that parents are encouraged to make an appointment to see their pediatrician sooner rather than later. We are seeing quite a bit of backlog of appointments alone. And in order to avoid issues with school participation as it relates to maintaining age-appropriate vaccinations of children, it's very important to just get that message out there to ensure that parents are cognizant of that early on and schedule an appointment, because we definitely don't want anyone to be excluded from school based on vaccination status. In the same vein, and just a last mention, we are closely monitoring the situation with measles as well. I know that has been an issue in the past, and I've just celebrated my 3 years with the county on Friday. I sort of started out with the measles outbreak, unfortunately, and graduated into this pandemic, unfortunate as it may be. But we are seeing not only a resurgence of measles cases globally, we're seeing quite a bit of travel, direct travel from areas that are endemic for measles. And when we're combining that with the reported lower rate of vaccination and not really adhering to those vaccine schedules, it's of course a concern, because the last thing we want is a concurrent measles outbreak with a potential resurgence of COVID-19 closer to the fall. So that is all in a nutshell.
Legislator Luan.
Thank you, Mr. Chairman. I don't know if I caught it. Any updates on STD rates?
They continue to be high. Unfortunately, we just had another congenital syphilis case, I believe 2 weeks ago now, and that was quite a concern. Thankfully, the child is doing well now and has been treated, but it continues to be quite the issue. I can provide the numbers, but we're continuing to see an increase in cases.
And do we still continue to lead in terms of statewide numbers?
Absolutely. So we are leading, I believe in congenital syphilis, we moved down to second after Westchester, finally. Second or third even. So we're still in the lead, but for congenital syphilis, not as high. For other indicators, unfortunately, as I've mentioned before, HIV with syphilis, new cases, especially newly diagnosed infections, we're still leading the charge in the state.
And it still remains in the under 25 years, if I remember correctly?
It's in the younger population, although we are seeing it in middle-age population. They are presenting a bit more to clinic now. Absolutely.
Legislator Tui.
Yeah, Commissioner, earlier with Commissioner Miller, I was asking about the overdose deaths and the numbers, and she wasn't quite sure she was going to check with you, but having you here now, I'm just wanting to see if you could give us a little update on that from 2020 and where we stand today.
Yes, so we have continued to see an increase in overdoses, specifically to opioids, but other substance use disorder-related deaths. I can most certainly provide the numbers. I will just ask our medical examiner. Just with the caveat that some of the toxicology screenings are not kind of as of today because they're still out and there's a bit of backlog, but I can most definitely report the numbers for a year prior and as close as we can get with conclusive.
Year to date?
Yes.
Yeah, as close as you can.
As close as we can get with a conclusive toxicology
Okay,
findings.
if you could just get that.
Absolutely.
Chairman and Doreen, and they'll get it out to all the legislators. Thank you.
Legislators, hearing none. Thank you, Commissioner.
Thank you very much. Have a good one.
Item number 3, Commissioner Ledoux and Director of Finance Strecker. Item number 3A is a request approval and appropriation of funds for a proposed 2021 capital expenditure for the water sewer treatment plant in the amount of $250,000 from appropriated surplus. Legislative request number 126. Do I have a motion? Legislator Tortel. Second, Legislator Lujan. Go ahead, Commissioner.
Thank you, Mr. Chairman. We have put money into this. We've had a capital project for this for the last few years. Last year, we did have to use $400,000 in expenses to upgrade the plant, so we want to replenish our capital project funds for future repairs.
Any questions? Legislator Cheney.
Yes, you mentioned that there's a pending facility-wide engineering assessment. What's the status of that? When will that be complete?
That'll be covered on one of the items on the agenda here.
Okay. We'll reserve the question then.
All in favor?
Aye.
Opposed? Carried. 3B, request approval and appropriation of funds for proposed 2021 capital expenditure to continue upgrading patient care mechanical lifters in the amount of $70,000. Appropriated surplus. Legislative request number 127, Legislator Sutherland and Legislator Tortel. Thank you. Go ahead, Commissioner.
So we do this project every year. We put in money for new lifters. Lifters have a useful life of about seven years. We have a quick count of approximately 40 lifters throughout the facility that we utilize. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. We have 16 lifters currently that are coming up on their 7-year useful life.
Anyone have any questions? Legislator Tui.
Do they have another life after this, after the 7 years? Is there any way, or are they totally
That's it.
destroyed?
that they can't be used again.
They can't be used.
Now, we can repair them up to a certain point, but then
I don't mean
Yeah.
for Valley View, but for any other type of.
I wouldn't donate an old lift
Okay,
to another agency
Okay, no
for liability reasons.
yeah, maybe another country though. or-
Yeah, yeah. Yep.
Any other questions? All in favor? Opposed? Carried. Item number 3C, request approval and appropriation of funds for a proposed 2021 capital expenditure for engineering services. Engineering to perform a facility-wide condition assessment relative to buildings, grounds, mechanical, structural, roofing, electrical systems, plumbing, and code compliance in the amount of $172,500. Appropriated surplus, legislative request number 128, Legislator Tui, Legislator Tortel. Thank you. Go ahead, Commissioner.
Thank you. We've been asked in the last year or last couple of years during our budget meetings whether a capital plan has been developed, and this is sort of an answer to that. We do believe we need to assess, including the sewer plant, our roofing, electrical systems, mechanical, plumbing, so on and so forth, to get an assessment as to what we need to prioritize, going forward in the future years.
Any questions? Legislative Cheney.
So when do you expect this study to get done? Because it just seems to be somewhat counterintuitive to be putting aside $250,000 a year to fix something that.
No, I understand that. We did have $400,000 in repairs last year that needed to be done or we'd be out of compliance. So we will get moving on this right away. You also have to realize that there is we do have to prioritize the projects that we send to get worked on through the law department and general services, because there is, time limitations and work that needs to be done on all these things. So we do have other projects that will be prioritized over this, but, this will be done. I can't give you an answer, but it is our plan to get this started hopefully soon. This shouldn't take as much requirement as far as an RFP or a bid as our Cowser HVAC or our boiler room projects. Those are very detailed specs that have to be drawn and detailed issues that the law department has to go over prior to sending out to bid. This will be, I think a lot more streamlined and will not be as involved as some of those other projects. If that makes any sense.
Yes, and understood. My concern is that it seems we're spending quite a bit of money on that wastewater treatment plant when we've been aware of the problems for quite a while, and the technology could change as a result of the study, and basically anything we're spending may be totally lost, and we're going to, basically
Right, and
not
again,
get much out of it.
Again, remember, any of the money that we spent on the wastewater plant is a capital project money that should go back into our Medicaid rate, so we will be getting a portion of that money back.
It's a wastewater
Understood, but not
management,
comforting.
so you really want to make sure that you have money available there in the capital plan for any emergency-related repair that becomes necessary.
Understood. We can't be in violation of the Speedies permit.
Right.
There's
Right.
no way, but at the same time, I think there's maybe a level of expediency necessary relative to the sewer plant that may not exist for some other areas of the facility.
Right. I mean, I don't know, we could get this study done and they could say, you need to upgrade the whole thing or scrap it or whatever. So, I understand your point.
Technology
Correct.
could be changed.
Right.
That's quite possible. And then again, taking into account the investment that's been made in the upgrades and the repairs, that may be reason to stick with the technology we've got and to get it in greater compliance. The investment may not be as great.
Right.
All right, thank you.
You're welcome.
Any other questions? When's the last time this was done, Commissioner?
I couldn't tell you. I've been here 8 or 9 years now, and we haven't done this, so it's been quite a while.
It's,
I don't know, honestly, I don't know if it's ever been done before. I've been here, so.
it's about time. All in favor? Opposed? Carried. Thank you.
Thank you.
Monthly finances.
Good afternoon, everyone. Can you hear me? Yeah, it's on, I hear
Just
it.
making sure.
We are at the 6-month mark in our financials. There hasn't been any change to the IGT funding since the last publication. The facility has received $1.5 million. We have a small amount of emergency disaster funding that we got. That totals $22,000. Last year at the same point under the CARES Act, we had received almost $1.9 million. Other revenues are coming in at $15 million. We have an additional 3 that will post into July. We started January, our census was 70.65. I'm happy to report today we are at 81%. It will be a slow and steady climb in our census. Lawrence and I are incredibly optimistic. That is a very positive to see. We started at 70.65, we're at 81. Personal services, we've spent $10 million so far at the 6-month mark. Equipment purchases, we've spent $18,500. On the contractual side, we have already earmarked $4 million for expenditure, and we've actually expensed $3.8 million. Employee benefits are coming in at $8.5 million, and we have a small amount of serial bond debt at $57,836. And that's all I have.
Any questions? Legislator Tortel?
Right. Historically, we don't hear anything about the remainder of the IGT funding usually until, I want to say, September or October. It's usually later in the year. And if you recall, we'll get a lump sum check probably in the late fall or December, and then we'll get another check or that check covers the first quarter of 2022 also?
Yes.
The last check usually comes late in the year, and we usually don't get notified of it until September or October,
Yeah.
just before we get the check. It has in the past. It's been more consistent over the last couple of years. That's why I can say that we're confident. We're expecting to get some notification in September, October. Years past, you'd go a year without a check, and then you get 2 or 3 big checks, and then you'd go another 2 or 3 years without a check. The last 3 or 4 years, it's actually been, knock on wood, pretty consistent and pretty much the same the last 3 or 4 years on how they've sent the money out. You're welcome.
So 2020, we got all our IGT money?
Yes, we did. The payment that we have recorded so far for 2021, we recorded $1.5 million, and that's for state fiscal year 10/1/2021 to 3/31/2021. So I would anticipate most likely somewhere around September, we should see another payment under the IGT program.
Legislator Tortel?
Right, remember, this is year-to-date, same time of the year for last year. So we didn't receive the money until the end of the year. So like I was trying to explain earlier, we'll get a check. To Donna's point, it's a check from October to March 31st of the next year. So a portion of that check, a quarter of that check essentially goes to the next year. Right, you take the portion, like for this year, if we get the check, let's say in October, we'll accrue everything that we need to for 2021, and then we'll accrue the January 1st portion through March 31st portion to 2022. And that's this 1.539 million for this year. That was from last year's payment. That was for January 1st to March 31st, if that makes any sense. It's accounted for in the notes, I think, in the audited
Yeah,
financials.
yeah.
Yeah.
You basically got a payment that encompassed October through March 31st. So October, November, and December are related to the prior year. So that income, even though it's received in 2021, gets allocated back to the year in which it belongs. So what you see here is the actual IGT payment that is attributable to the fiscal year 2021. It is confusing.
It is, and then the, correct.
So what you're looking at is a snapshot of comparison, what's this year to what was last year.
So last year, we got more money
Just
for
a
the,
picture of where
right.
it's a little confusing, but it's just a picture of these months for last year compared to these months for this year.
Right.
So you have an idea of how they're doing compared
So-
to last year.
So the last,
Not a full picture of what, just an app. It's a little confusing. Right.
the previous year's IGT payment was larger, thus the larger amount for last year's accrual.
Right.
Yep.
Question? Okay, monthly update.
Not too many changes on my monthly update from the previous month. As Donna mentioned, our census for July as of today is 81%, which is good, so we are hoping to keep that trend going. Our census today is 80.55. We have no residents with COVID. We have one staff member that is out due to COVID contact precautions. 91% of our residents have been vaccinated and 61% of our staff have been vaccinated, and we continue to regularly offer the vaccine to both residents and staff. The COVID testing for staff has changed. If you have the COVID vaccine, you no longer need to be tested regularly unless there's a new outbreak in the facility. And staff that aren't vaccinated must get tested twice per month. The Valley View CHA is continuing to do well. We currently have 10 patients. Each patient typically receives 4 rehab visits per week, 2 by physical therapy, 2 by occupational therapy. These visits occur after initial visit assessment completed by the RN. The assessment develops a patient's plan of care. And we continue with personal caregiving and compassionate caregiving visitors at the facility. So also, I didn't put it in here, but we are starting to be allowed to do more group activities with the residents, which is nice. So we're getting, I won't say we're getting back to normal, but we're getting back to a little bit closer sense of normalcy for the residents, which is good.
Legislator Tortel.
We have on occasion, most of the referrals for the CHA are coming right from Valley View. So they come to Valley View for rehab, and then they still need rehab when they go home. So that's where the CHA comes in, and then that's where the majority of our referrals are coming. Yes, yes. Yes, yep.
Lawrence, how about the hiring for the CHA, the positions, the staff? I know one of your previous updates, you're having a hard time filling.
We're having, I'll be honest, we're having a very difficult time recruiting nursing, and it's not just a Valley View issue, it's an industry-wide issue, and it's not just a healthcare issue. I think it's a employer issue across the board, hiring qualified people to come into work. In our case, it's specific to LPNs and RNs. We are talking about some additional strategies to increase our hiring numbers. So I have to get together with Donna. I have some ideas about maybe creating some incentives for people to come on
What I'm
board.
getting at is that you, the previous meeting, I think when you first started up, you had like 2 or 3 patients, and you didn't have enough people to take more patients in.
Oh, yeah, we didn't have any home, we couldn't find any home health aides. I believe we have I think we have one person now that is able to do those services, and that should, he was going for a license, but that's it.
That one person handles the 10?
Well, no, not everybody will need a home health aide. Most of the residents just need the therapy, but a few of them need the home health aide to do a shower or a bath or something of that nature.
So you still have one?
Yeah, it's difficult. Yep, and I came to you, I think if you remember, I asked you to increase the rate, and you guys did, and that hasn't helped either. So it's a struggle out there right now to find good people.
Hopefully in September, maybe.
I hope, yeah, I think I mentioned that last time with the unemployment, and, yep.
Any other questions for Commissioner? Hearing none, thank you.
Thank you.
Thank you.
Appreciate it.
Legislator Luan, Legislator Tortel, thank you. Thank you all for attending. Have a safe trip home.